Welcome back. What I thought I would do now is show you the ventilation sensor in action, as well as the CPR sensor being used with both the Cube X and the the instructor tablet, but giving live view feedback that can then be either shown to the participants via a cable to another big screen, or if you purely want to see that yourself as the educator instructor, you will have that on the screen. But remember, any of the main clinical devices that have a CPR sensor built into the defib pads, you should, like on the Zoll X series, the qubeSeries, and some of the LifePak products, you should be able to see that on screen in terms of the CPR. So where we're currently at is we haven't actually got monitoring on the patient yet. So what I'll do is I'll just pop some leads on here. So I am adding the CPR sensor, because if I don't, we're not going to get any of that feedback happening. And what I'm going to do now that I know everything's translated here is I'm going to turn this into a cardiac arrest event. So I'm just sending that. So now we get all our alarms happening, and there's our VF. It looks like a kind of medium VF, not too fine and not too coarse. So what I'll do is start off by opening up this window. You'll see where following down the right side of the screen, you see CPR fraction, that box. It's actually the feedback for ventilations and CPR. And I'm then tapping group so that we get the summative data in live view up here. And now what I'm going to do is start chest compressions. And immediately it picks it up and it's saying that my depth isn't quite there yet. And my rate's a little bit quick. So I'll slow my rate down. Hopefully we go a little bit deeper, and what you can see is it's giving the yellow arrow to say go a little bit deeper, still a little bit faster in terms of my rate, and now I'm getting better depth, and so it's changed to green, which is helpful. And now I'm going to pause and give 2 breaths, and you can see that they're both green, which is good. And here we have our chest compression fraction as well in live view. Obviously that will change if I pause, but in live view, it's currently up around 75%, and it's gone green, which is really good. So obviously my rate and also my compression depth and release is good. And I'm going to pause and give 2 breaths. And I'm going to keep that going just so you get a good idea of how the colors interact on screen. So as we know, we want to minimize hands-off chest time, but we do want to deliver reasonably good quality CPR with a rate between 100 and 120. And for our adult, our depth between 5 and 6 centimeters. So I'm just around there. My chest compression fraction currently, which is green here, is 81%. So I'll pause and give 2 breaths. I'm completely out of sync in terms of the pausing for breaths, but I'm just trying to emphasize the importance of the feedback for you. So what I'm going to do is pause now deliberately, because I want to actually charge this up in manual mode so that we can then start getting the CPR data on the actual screen, as you would expect on a real Zoll X series. This is pre-programmed to 250 joules. It's gone all the way up. That's a shockable rhythm, so I may as well shock it. Everyone is clear, it's all good. I'll deliver that shock. So now when I start CPR, we now see that we're getting our depth on screen, and we're also getting our rate, just as we are here for the instructor. And I'm just comparing numbers, and that looks really good. So in fact, if I move this over here, hopefully the screen will be nice and clear for you. So my rate's still a little quick, and my depth has gone shallow. Difficult to do 2 things at once. And I also just want to draw your attention to the fact that we have artifact automatically applied. So when I stop doing CPR, you'll begin to see your VF underlying rhythm. And as soon as I start CPR again, you see your artifact being applied. So what I'll do now is I'll stop that, and then I'm going to end that. And now we have the option, if we wish, to go back in and have a look by clicking on menu, training logs, and then going in and tapping on the actual log itself. And I will produce a separate video on the data for the log, but what's important to note here is everything is color coded. It separates out the quality of CPR from the ventilations, and of course you can focus in then on anything that needs to be improved or refined from a quality CPR point of view. And we also have the timestamp log for all interventions and also any pauses in CPR. Any shocks delivered will also be identified, including the time the shock was delivered, the joules. Same thing with pacing. If you were to pace a patient, it will also give you all of that detail as well. So I hope that's been helpful in terms of how the ventilation CPR component of the system works, and thank you for watching.